This is a pentavalent vaccine which has 5 components: diphtheria, tetanus, pertussis, Hep B, and HIB, that is Haemophilus influenza type B vaccine. The most important thing they can ask you is the age. So it is given at the age of 6 week, 10 week, and 14th week. Here 3 doses are completed. Then the booster dose of DPT is given at the age of 16 to 24 months, followed by second booster dose in 5th year. The route is important. So the route is IM, given on the anterolateral aspect of thigh in zero point 0.5 ml. The adverse events following immunity can be because of whole cell of pertussis. That's the reason instead of whole cell, acellular pertussis is used. So the adverse effects of pertussis are fever, persistent consolable crying, hypotensive hypersensitivity. Even if you don't remember all, just remember that the fever and inconsolable crying. Then there are some contraindications to this vaccine. What are that? Just because of pertussis again. If the patient has progressive epilepsy, then pertussis is contraindicated. More they can ask you that what are the recent thing which are being included in this vaccine. Same thing like wholesale, earlier wholesale pertussis was used, but now acellular pertussis is used because of its adverse reactions and its contraindications. Next, for any vaccine, the age of the baby, the route, the site, and the amount of vaccines are the basic ones which you need to answer for sure. Then what are the new vaccines? Then you can say that DTPA is used, that is nothing but acellular pertussis. BCG vaccine is most important one because it is given at the time of birth of baby. So BCG vaccine is given at the birth in a single dose IM. It is given on the deltoid. In the amount is important over here, that is 0.05 ml, not 0.5 ml. Okay, so it is 0.05 ml. They can ask you what are the contraindications. So this as such though no contraindication for BCG vaccine, but there can be adverse effects following BCG, that is osteomyelitis, lymphadenopathy are the adverse events following immunization. That they can ask you what if you miss the dose of BCG, up to what age it can be given. This ambroxyl hydrochloride syrup, it is just, you have to mention that it is a mucolytic drug which is used in the treatment of cough for the baby, and it has to be shaken well because of its suspension property. Then comes varicella vaccine. So this is an extra vaccine which is used to provide immunity against chickenpox. It is not included in the national immunization schedule, but it can be given in combination with the MR, that is measles and rubella ke sath it can be given. So it is given at 2 doses. It is given in 2 doses, that is one at 15 to 18 months. The another dose can be given at 4 to 6 years. It's given subcutaneously. Then paracetamol oral suspension. This is paracetamol can be used as an analgesic. It can be used as an antipyretic. So it has various purposes. Paracetamol, the syrup. See, if they ask you the dosage, remember one thing, that dosage can be calculated like according to the weight. So measles and rubella, earlier MMR was included in the national immunization schedule, but they have removed mumps from the schedule because mumps was not a dreadful disease which could lead to the death of the patient. So they have removed that mumps, and now the immunization schedule consists of measles and rubella only. So our vaccine, it is given at the age of 9 to 12 months के बीच में, and it can be given till 5 years of age. It is given subcutaneously on the right upper arm and the quantity is just 0.5 ml. Then coming to this acetaminophen is nothing but just paracetamol. Same thing you have to mention that it is used in the it is used as an antipyretic, it is used as an analgesic. And if they ask you the dosage, then you just mention the dosage depend on the weight of the baby. So this is a midazolam injection which can be used for IM and IV. It is used in controlling neonatal or pediatric seizures. You can mention this. And if they ask any dosage, you can say कि it depends on the weight of the baby. Dosage is 10% of the baby's weight usually. This is amikacin. So amikacin sulfate, it can be given in IM or IV use. It is a very strong antibiotic which not only stops the bacterial growth but also prevents further growth of bacteria in blood, brain, or lungs, or skin, or abdomen, or bone. So it can be used in the infections such as septicemia, meningitis, pneumonia, osteomyelitis, etc. If they ask for any side effect of any injection, then first thing you have to mention is local rise of temperature and local tenderness at the injection site. This is the safest thing you can say. Next, this is again DPT vaccine. Again DPT, adrenaline. So adrenaline, see, there are several uses of adrenaline. Adrenaline, it can be used during the neonatal resuscitation in the dosage of 1:10,000. Then they can ask you all the doses of adrenaline, when is 1:1,000 dose of adrenaline given, 1:10,000 of adrenaline dose given. So similarly, like, they can ask you everything. Usually adrenaline, it is an emergency drug which helps in the reviving of baby, or else it can be used along with the anesthetics to increase the action of the another drug. Rotavirus. Rotavirus is now included in the immunization schedule. It is given at the age of 6, 10, and 14 weeks as 5 drops in oral form. The adverse effects of rotavirus is interception. This is the most common, which everybody should know. Hepatitis B. So hepatitis B, it is given, it is vaccine which is given at the time of birth. If it is given in the amount of 0.5 ml, it is given in IM form, and it is the site for this is anterolateral aspect of mid thigh.